or hydatid in humans. Those are the tapeworms that we are going to talk about. Here's a... Oh, yeah, that would be probably... that. Yeah, sure, thank you. Yeah, okay, here's the... It's not the human, as far as I know, it's not the human tapeworm, but they can be... Now you can count the number of folds, multiplied by 40 centimeter, and can realize how big that tapeworm would be. They are normally identified, and I would like you to sort of know the salient features. The shape of their head, or is referred to as scolex, and the shape of the segmented body segments. These body segments are actually reproductive organs, and these are ovaries that have branching. They may have many branches or a lot fewer branches, okay? Or they may be very, very sort of longitudinally stretched. They may be that shape. And that is what provides the basis for identification of those worms. You do have pictures of those in your handout, and also on the web. They are distributed worldwide, depending on the dietary habits and the quality of cattle and pork. Here is the picture of a beef tapeworm. It has a head area, and then these segments, those are referred to as proglottids, and as I mentioned, those are reproductive organs, actually. They can be motile, as you can see, how they can move by folding over, straightening, and then sort of somersaulting segments. Okay, Taenia saginata, scolex, has got these suction cup. There will be 4 of these at the head. Okay, and then that's called proglottid, and scolex, and this is proglottid, and proglottid is long, and many, many branches, and the number to remember really is more than 13. As opposed to Taenia solium, the scolex is sort of like sunflower. That's why solium, the word solium, is associated with it. The scolex, and these actually raise our hooks, which the worm uses to attach itself to the intestinal mucosa. And here the ovaries are a little bit shorter. The proglottids are a little bit shorter. Not only that, but branching is very much limited at 9, 10, that sort of number. So if you see anywhere that many branches of the ovary versus that, you should associate those with the respective tapeworm. The life cycle is, almost. It is the cattle or the pork are the links to the life cycle, and humans get infected when they eat the flesh that contains the cysts. These are referred to as cysticerci or cysticerci. And they can be in the liver, they can be in the muscle, they can be in the brain. So whatever part they are in, if that is consumed with improper cooking, they can resist the stomach environment. The larvae resist the stomach environment, migrate to the intestine, and then they mature to become fully grown worms and produce proglottids that are extruded in the fecal material. And those proglottids, they produce eggs. Those are ovaries. They produce, and they are hermaphroditic. So male and female are in the same proglottid. And they are going to produce fertilized eggs, and that it will be laying around on the in the grass. And as the animals graze, pigs are omnivorous. They use vegetation as well as the meat. But as they graze, they are ingested. Those eggs are ingested. They will hatch in the intestinal tract. They will produce larvae, and those larvae are going to migrate into the different tissues. And when those tissues are consumed by humans, the humans are going to get infected. So it's a cycle between animals that get infected by consuming the egg. Humans get infected by consuming the flesh. There is one exception to that, and we'll talk about that in a minute. Okay, the symptoms depend on the worm burden. One worm may not do anything much to produce much symptom, but more than one or two or many worms are going to produce some symptoms, and those will include abdominal discomfort, epigastric pain, vomiting. It's all due to the presence of the worm. Other organs? In humans, beef tapeworm is not going to produce any other symptom than gastro and intestinal involvement. However, the beef tapeworm, that's Saginata. However, in the case of Taenia solium, humans can get infected by ingesting egg as well. Okay? So beef the flesh containing cysticerci, either from Taenia solium or Taenia saginata, can infect humans, and that will be GI tract infection. Whereas in the case of Taenia solium, humans can also get infected by ingesting eggs. And those eggs are going to hatch in the GI tract, and they are going to produce larvae. These larvae are going to migrate into different tissues, and they are going to produce cysts, just like they produce cysts in the in their intermediate host being pigs. Okay, so that's a very important distinction in to note between the Taenia solium and Taenia saginata. Taenia solium can produce cysts. Taenia saginata can only produce GI tract infection. Depending on where the cysts localize, they may be in brain, that will cause encephalitis, eye leading to blindness, lung abscess, liver abscess, and any symptoms related to those organs. Okay, here is a picture of cyst, a muscle cyst. Here is heart. Many cysts. It can be, this is from the cattle. In humans, Taenia solium cyst in the brain causes various neurological symptoms depending on where the cyst is localized in the brain. And by some estimate, a large proportion of neurological problems in some South American countries and as well as other developing countries is due to cysticercosis. Here is autopsied brain showing the cysts there. Okay, diagnosis is based on symptoms. Often these things are revealed on, if these are cysts, will be revealed on X-ray, on radiography. And I thought I had some pictures of those. It may come later on. Symptoms are history of diagnosis based on symptoms as well as history of eating undercooked beef or pork or salads that may be contaminated with teniosolium eggs. Typical scenario, you're visiting a farm in some developing country and you come back and you have certain problems. And there may be cysts in the muscle or other organs. The definitive diagnosis is based on recovery of proglottids in the stool or the eggs in the stool. And the proglottids will be, here is the picture of proglottids or eggs. Teniosolium and Taenia saginata eggs, one cannot distinguish between the two. Quite honestly, you don't have to distinguish between the two because the symptoms are the same, GI infection symptoms are the same, and treatment is the same as well. Okay, and here is Taenia saginata, multiple branching of the ovary and limited to, I think, 1, 2, 3, 4, 5, 9 or so branching. Okay. CNS symptoms, if it is cysticercosis, CNS symptoms are symptoms involving other organs, a history of ingesting food with teniosolium eggs. Radiographic localization of cysticercosis establishes the organs involved. Here is another picture of, okay, there and there, cysts in the brain. Here is a radiograph of arms, and there's a cyst here and here. Those of you who are going to go into radiology will probably go through those again. A few years ago, there was a student, after graduating, during his residency, he sent me an email. He wanted a whole collection of my parasitology slides and presentations. So, he had them because one of the segments of the radiology residency was to how one identifies different worms through radiographs. Okay, treatment is based on, treatment is praziquantel, and that is the, that would be the drug for all tapeworms and even flukes. Prevention, adequate cooking of the meat. One does not have to worry too much about in this country because meat is not only inspected, but also freezing can kill the the tape as well, cysticerci. So, and here the processing, meat processing is, they do freeze it and then use power saw to cut the meat. So that's why we have very, very low incidence, if any, of tapeworm infections. Okay, so freezing is good for it. And cysticercosis, a typical scenario you might see. 5-year-old Latin American girl is presented to ER for having focal seizures. She had a history of pinworm infection and more recently abdominal pain and fever. after a trip to Mexico. That was attributed to viral gastritis. A CT scan showed ring-enhancing lesion that you saw in the other previous one of the slides in the left parietal lobe with surrounding edema without hemorrhage. Suspecting cysticercosis, she was successfully treated with praziquantel. So that's, you can see that sort of typical scenarios. Okay, so that's about the beef tapeworm and the pork tapeworm. But I just want to emphasize, you've got to make the distinction between the two organ tapes, and also remember that the Taenia solium can cause cysticercosis in humans, whereas saginata does not. Fish tapeworm. So you can't eat any beef, and you can't, certainly not rare steak. Okay? And you cannot eat improperly cooked rare pork either, rare ham. Okay, the fish tapeworm. Its scientific name is Diphyllobothrium latum. If you think of the name diphyllo, chlorophyll, phyll, leaf. Di is two. Looks like two leaves. Bothrium means a groove or a ridge. Okay, a groove. So you will see the enlarged picture of that and realize that why it is named that. And latum refers to the way, the shape of the proglottids. Distributed worldwide, a common freshwater fish tapeworm, northern lakes, freshwater. The fish there is infected, has been found infected with this, with these tapeworms. Here is the description. Two leaves, a groove, okay, Diphyllobothrium, and the proglottids are longitudinally stretched, latum, longitudinal, and that's the name sort of describes the morphology of the organism. That's the egg fairly large, but 70, 80 micron, or even 100, 150 micron in one dimension, and about 50, 60 micron in the other dimension. Life cycle is from humans get the disease by ingestion of fish that has cysts that has in its flesh plerocercoid larvae. Plerocercoid larvae are in the flesh of the fish. Humans, if they eat it uncooked. And 1 year I tried to put people off sushi. Well, sushi is mostly seawater, oceanic fish. So you can still enjoy your sushi. Don't have to worry about that. But the freshwater fish does contain it. And if you don't eat cooked properly, and there are some dishes that are based on eating raw fish or uncooked fish. So one has to be careful there. These larvae, they are swallowed, they resist the gastric environment, they migrate to the intestinal tract, and then that's where they will become very large tapeworms. And those tapes, the proglottids, they will produce eggs. Eggs, if they are laid near water, they are going to wash into the water. They are going to produce miracidia that is swallowed by cyclops, water flea, that again intermediate host, just like for the guinea worm. And there is another intermediate host being the fish. When fish swallows these infected cyclops, water fleas, they are going to develop into pleurocercoid larvae and migrate to the fish, to the flesh. So they continue the cycle. Again, depending on the worm burden, it will be severity of these symptoms will depend on the worm burden. Abdominal discomfort, rarely severe cramping, pain, diarrhea, alternating with constipation. Vomiting may occur as they irritate, the worms irritate the GI tract. The general is weight loss, and there is a characteristic vitamin B12 deficiency, and of course any symptoms that are related to vitamin B12 deficiency will ensue. That is all due to the physical mass of the worm presence, and also some inflammation. The diagnosis is based on symptoms and then history of eating raw fish, and confirmatory diagnosis will be based on recovery of proglottids or that are longitudinal, that they are very different from the Taenia solium or Taenia saginata, or the presence of a large worm, a large egg in the treatment is praziquantel, is the drug of choice. And the preventive measure would be not consuming uncooked or not properly cooked freshwater fish. Freezing for 24 hours, again, kills the worm. So if you don't insist on fresh fish being served as an uncooked delicacy, if it is frozen, then it's okay, it's safe. Okay, Hymenolipsis nana is a dwarf tapeworm, is also referred to as dwarf tapeworm. It's a tapeworm of the rats, but humans are sometimes infected with it. It's transmitted to humans by a flea, really, from rats to flea to humans, and then back to the fleas. There can be a cycle without involving the fleas. Okay, the lighter infections, nothing significant really, mild abdominal disturbance. So, and then more heavier cases may cause enteritis. Okay, and the treatment is praziquantel. Diagnosis based on symptoms, rodent infestations. So if you've got lots of rats around living with you, be wary. Ova are found in the feces. Okay, and here is a indiscriminate ovum. You cannot distinguish between the ovum of beef tapeworm or the pork tapeworm or the rat tapeworm. Okay, treatment is same as any other tapeworm. Praziquantel is the drug of choice, and control of rodent population is a preventive measure. Now we will talk about Echinococcus, Echinococci. There is a Echinococcus. There are two genera. There is a multilocularis and Echinococcus granulosus. The red areas are Echinococcus multilocularis, and you can see that most of Canada is has got the areas is endemic for these tapeworms. These are actually sheep tapeworms. Typical scenario: a 32-year-old Kenyan woman presented in Boston with 3-month history of cough. This is was New England Journal of Medicine published. I've just summarized it. 3-month history of cough that was initially productive of thick gray sputum that had gradually become blood-tinged. She had low-grade fever. Chest radiography revealed an apparent elevation of the right hemidiaphragm. So there was some sort of cyst there. CT scan of the chest with contrast medium revealed low-density cystic mass measuring 13 by 13 by 10 centimeters in the right lower hemithora. Okay. Ultrasound guided aspiration of the content of the cyst yielded clear, colorless fluid containing protoscolex of Echinococcus granulosus. We'll show you the sort of more clear drawings and pictures of those in a minute. So that's the 3 days later, cystectomy was performed with the use of specific precautions to prevent local spread of the disease. After adequate anti-parasitic treatment follow-up, radiography demonstrated re-expansion of the right lung. The patient has returned to her normal level of activity, and there is no evidence of recurrent disease. Okay? So that is a typically Echinococcus. It's the causative organism, Echinococcus granulosus. These are proglottids, 1, 2, 3, 4, very limited number. It's a small, short-ish tapeworm. What you see in that protoscolex that you saw, that is also referred to as hydrated sand, these are the larvae or protoscolexes that are floating around in the fluid in the cyst. Here. Okay, the life cycle generally is humans get infected when they consume any eggs that are laid on the grass or the fecal material from the carriers. These dogs are carriers. Let's look at the natural life cycle first. The sheep have got these cysts, hydrated cysts, that will contain those infective proteoscolia, and then the dogs will eat it. They migrate to the intestinal canal of the dog, and they will produce eggs that are excreted in the fecal material. And they may lie around, and sheep, as they graze, they may eat those and get infected. Humans are really incidental or accidental victims. So typically, if you are a sheep farmer or you're visiting sheep farm and some of the material you may have ingested contains the eggs from these tapeworms. And there it can produce cysts anywhere, abdominal cysts. It may produce the egg will hatch in the intestinal tract, and it is going to produce the worm larvae that are going to penetrate in different tissues and produce those cysts. Symptoms are based on the presence, because of the worm, and also it produces enormous ascites or fluid in the cyst. The abdominal distension can result from the presence of the worm and growing cyst, and the ascites will also cause distension of the abdomen. And I think I may have some pictures around here. Okay, if one looks at this cyst, this is actually multilocularis. The Echinococcus granulosus produces one large cyst in which contains protoscholii. Okay, those larvae. And however, the multilocularis is a little bit different in appearance of the cyst. They have got multiple cysts here, like a bunch of grapes. Okay, if one looks inside those cysts, one will find a sort of granular wall, find a wall around the cyst, and then inside that wall there may be daughter cysts appearing, or it will have fluid that contains proteoscolex, or also referred to as hydatid sand. Here, of sandy appearance. And they're just swimming around in the fluid. If it is in the liver, there will be obstruction, jaundice, due to growing cyst, pulmonary abscess, cough, chest pain. In that case, it may also cause fever, pruritus, irritation, and anaphylactic reaction. This is one of the few worms that cause more severe allergic reaction, IgE production, and allergies. As a matter of fact, when it is resected, if there is a cyst there in the abdomen, one drains the fluid or takes out all the fluid first, or inactivates the fluid by injecting small concentrations of formaldehyde so that they are fixed and protein is denatured. In the CNS, it will cause unilateral epilepsy, Jacksonian epilepsy, and that is due to growing cyst. Here's another. This one is definitely the hydatid granulosus, Echinococcus granulosus, not the multilocularis that you saw earlier. So those are the symptoms. The diagnosis is based on endemicity. In this country, I can't remember if there have been any cases indigenous, but Puerto Rico, there have been cases from some of the islands. Spain is particularly maligned. Okay, then the symptoms of a growing mass, really. That's very indiscriminate symptom. Then, of course, CT scan or X-ray will show the cyst, a little bit more definition of the cyst. And serology, one can detect antibodies against the constituents of the organism. The antigen is usually ground up Echinococcus, and one tests the blood for presence of antibodies. There is a skin test available. It's referred to as Cassoni test. And since, remember, it is a type 1 hypersensitivity reaction, it will be just like a skin test for allergies. Treatment is surgical removal of the cyst, and also I did tell you that, yes, there is, one has to inactivate the fluid. Otherwise, during surgery, if the fluid is spread in the body, it is going to cause severe and fatal anaphylactoid reaction. The avoidance of ingestion of eggs, so good hygiene in the infested area, or treatment of the infected canine would be a control measure. Multilocularis, as I mentioned to you, is present in colder climates there. Okay, it is Echinococcus granulosus, similar symptoms, except that the secondary hosts and reservoir are rodents in this case. Okay, in the case of secondary reservoir for the Echinococcus granulosus were canines, wolves, and dogs, whereas in the case of multilocularis is the rodents. Okay, that's the picture you saw earlier. Treatment, praziquantel is the treatment, and surgical removal of the cyst, the same as for granulosis. So that is the flatworms or tapeworms.